lead poisoning remains a poignant threat to maternal and fetal health, contributing to a range of adverse outcomes, including miscarriages and premature birth. Pregnant women who are exposed to lead are at significant risk, as lead can cross the placenta barrier, affecting the fetus during a critical period of development. According to the World Health Organization, no level of lead exposure is considered safe, particularly for pregnant women and young children, making the removal of lead exposure sources a public health priority. Well, non-governmental organization Pure Health Ghana is shining the spotlight on the silent threat of lead poison ahead of International Women's Day. Joining me in the studio is Esmond Wisdom Kwanzaa, Ghana's country director for Pure Health Blacksmith Initiative. Esmond, the lead to this story is more scary.
Right.
I mean, lead and its contribution to miscarriages and complications with birth. How bad is it?
Yeah, thank you very much for having me, and I would like to use this opportunity to thank you and the management for always giving us the opportunity anytime we knock at your doors. The situation of lead poisoning is a dire one, and in Ghana it's a public health concern, especially its effect on pregnant women, lactating mothers, and children is unbelievable. And to be honest, the whole population is at risk. But Pure Earth has been shining light on the maternal health ahead of the International Women's Day. The idea is to, one, empower women with the knowledge and the resources to protect their health. Two, we also want to engage with policymakers, government agencies, international women organizations to, advocate for regulations. I think regulation in this area need a lot to be done. And then finally, the media, of course. Lead is a silent killer. According to a recent model by Bank of Ghana, which was published in the Lancet Planetary Report, between 3 to 5 million people are at risk of dying through lead poisoning every year. And as you've just read, some of the complications in maternal health, stillbirth, babies with no weight, it's huge. And the records of this in this country is alarming.
So in terms of exposure, how does one get exposed to lead?
Right. So lead you can be exposed to lead through contact with the soil. 90% of the exposure is through the soil. One of the major sources is used lead acid batteries. 75% of your car battery is made up of lead. And so when it reaches its shelf life, what happens is that the lead in the battery is recycled. And in the process, if it's not done well, it pollutes the environment. Now, once the lead is deposited in the soil, it remains there until it is removed. So that's one of the major sources. Secondly, through those who work in the e-waste cycling or these scrap pickers can accidentally come in contact of this lead. Again, we are talking about, I think a research that we did last year revealed that 77% of locally fabricated cookware had higher levels of lead concentrations. We also went further to do a market survey of some of the locally fabricated cookwares. So you can potentially be
cookware, the things we eat from.
What you guys popularly call it, that is saying,
right.
Locally manufactured ones.
It has a large deposit of lead.
Lead concentrations in them. And so we can't contract this. So
therefore, eating from such cookware can endanger your life.
Definitely, especially with the locally fabricated ones. We want to make emphasis. We don't want to create panic. It's not all of them. It's the locally fabricated ones. Extensive work has been done in that area, and we're still engaging authorities that matters to do a lot of work. I must say that lead poisoning is a public health issue. I was in your studio here, I think a few months back, and we put out some statistics. We've done some study that shows that 53.7% of children that were surveyed in Greater Accra, Ashanti, and that of northern regions have higher blood lead levels, which is cause for concern. We have been engaging, since then I've been engaging authorities. The EPA, for example, have done remarkably well. Once we presented our study, we, together with UNICEF and Ghana Health Service, put together an action plan to call on the Ministry of Health to do some urgent work in that area.
About it.
And I'm happy to say that we recently presented the action plan to the minister before he exited, and I think he has asked the
new one.
Yeah, no, the one who just exited. But he has asked us to meet the ministerial technical team,
right,
to look at the plans we have recommended for immediate review and implementation.
All right. I know that lead poison is also very pronounced in mining areas, especially those into illegal mining. Exactly. But ahead of the International Women's Day, what is Pure F doing to raise more awareness, and how are you going about it?
Yeah, so granting us opportunity to be on your show is one of the media engagement. You have a lot of mileage, and so we are calling on people that matters to join us to advocate for lead prevention, because its consequences in maternal health is really serious. We are also being granted permission to engage the maternity ward of the Greater Accra Regional Hospital in Rich here to educate the mothers of the effect of lead poisoning and what it does to them, their unborn babies, and the children in general. And also, we are also having a DEBA and a SHAMAI.
Right.
Fetal line is one of the most polluted areas when it comes to lead pollution. So we're engaging the community there. We are collaborating with EPA in Tema and also Ghana Health Service to educate the population about the dangers of lead poisoning on maternal health.
And we'll have our camera follow you tomorrow as we mark the day. Thank you very much, Esmond Kwanzaa, for coming through. And the issue is about lead poisoning and the dangers that are inherent in this particular area. Well.